we want to bring in someone else to this conversation about this growing risk.
Yeah, so we're talking to obstetrician gynecologist at Memorial Hermann, Dr. Abigail Zamorano. Good morning. Thank you so much for coming on the show to chat with us about this. As Haley was just talking about, why is it women in low-income households are at a greater risk for getting cervical cancer?
Well, I think that this study brings up a good point in that cervical cancer is entirely preventable. It's one of the only gynecologic cancers that we have a screening for and that we really can prevent. So clearly women are falling through the cracks either in the prevention through the HPV vaccine or with early testing such as pap smears. And then also I wanted to highlight treatment. So a pap smear in and of itself doesn't take care of it. If you have an abnormal pap smear, you have to have biopsies and potentially the treatment so that it does not progress to cervical cancer.
Yeah, so cervical cancer is a preventable cancer. So I know you're mentioning pap smears, but elaborate on what all women can do to eliminate their risk of cervical cancer.
So start by getting the HPV vaccine. That can be given as early as age 9, but ideally ages 11 through 12 to both boys and girls. HPV is a sexually transmitted infection, but it's important for everyone to have it, for us to have the vaccine to decrease the community presence of the virus. Other things that women can do is to see their general OBGYN or other provider for regular pap smears, and then to really follow up on abnormal results. However, even if you're getting regular screening, if you have symptoms such as abnormal bleeding or pain, you should always see a provider for evaluation.
Doctor, I want to talk to you about what this new research tells us about barriers to getting these screenings. We talk about access, but have we learned anything about environmental or situational when it comes to this study?
I think that it just highlights the fact that that you need to be able to see a healthcare provider in order to prevent cervical cancer. And so the fact that women in low-income households have higher rates and mortality of cervical cancer, that tells me that there is something flawed in the system and they're unable to get the preventative care that they deserve. It also highlights the fact that there are likely not specialists like me. I'm a gynecologic oncologist. There are not specialists like me in all communities. And so women in some lower income households probably have to travel further to receive high quality care or the necessary care for treatment of their precancer or their cancer. But even if you live around the corner from a hospital, it doesn't mean that you have access to that hospital. So I think this highlights a lot of deficiencies in our healthcare and ways that we can really make it better so that all women have the opportunity to prevent cervical cancer.
Well, Dr. Zamorano, I'm gonna elaborate on that a little bit, because you mentioned that women might not have, have to travel farther, but transportation is a barrier. If you have to pay for your transportation, that's a barrier. For somebody living in a household that's making less than $39,000 a year, that's a barrier. Child care. You have to take off of work, which then you might not get paid. So you're not getting paid to go to work. You're having to pay somebody to watch your children. You're having to pay to go to the doctor's office. I mean, it's just a big no if you're in that situation. So I don't think there's a huge surprise that it's actually, the cancer is actually rising in this age group. I think this socioeconomic group, I think the big revelation is that they're just, getting missed by society as a whole, not even just in the healthcare system.
Yeah, you're right. These younger women, or really any women, they have children of their own that they're trying to take care of. They might also have, relatives, elderly relatives or family friends that they're also responsible for, and they're trying to work, and they're having to pay for transportation, and they're also having to pay for parking. Like, there's so many factors that go into this that are ways that hopefully we can help to try to reach these patients.
I want to go back to, you were mentioning the HPV vaccine earlier, and a big idea that came out of this research too is showing that while yes, it's on the rise in these women, it's also showing that people who have gotten the HPV vaccine are not seeing the same rise in cancer. In fact, they're not seeing much of this cancer at all. So could you elaborate a little bit more on why the HPV vaccine is important? Because chances are these women basically have kids who are eligible to get that vaccine now.
Yeah, so the HPV vaccine targets 9 different strains, high-risk strains of the HPV or human papillomavirus. And so those high-risk strains are the ones that we know are most likely to cause cervical cancer. They're also more likely to cause vaginal, vulvar, penile, oropharyngeal. So it's not just cancer for women, it's actually both men and women who can be susceptible to cancers that can be prevented by the HPV vaccine. It's important for every child to receive it. Again, as I said, ideally around age 11 to 12. This ensures that it's before exposure to HPV, but it's also the time when their immune systems are probably the best able to use this vaccine for good, so that their bodies are able to then fight off the virus if and when they're exposed to it. I also want to point out that up to 80 to 90% of men and women will have HPV at some point in their life. This isn't a rare infection. This is something that, frankly, most people have, and most people can fight off even the high-risk strains, but it's those lingering strains of especially high-risk virus that can cause the cellular changes and lead to these cancers.
Forgive me, I do have one question. You know, a lot of this conversation is focused on accessibility here, and especially particularly for those in lower income families. And we talk about this vaccine and it being most effective when administered to girls ages 9 to 11, I believe is what you said.
And boys.
And boys.
Girls and boys, yep.
Is there any sort of effort happening to roll these vaccines out in schools when it's time to get other vaccines, when we talk about accessibility being a factor here?
Yes, that is largely dependent by state and what the state will encourage or allow. HPV, the vaccine can be part of the I'm forgetting what it's called, but the
routine
insurance
vaccines?
is provided for kids, and so the kids are able to get the HPV vaccine. That it shouldn't be of any cost to them. The key is educating their parents who are making these decisions for them on the importance of it, and also moving away from thinking about the vaccine as targeting a sexually transmitted infection, and really thinking about it as a cancer preventative vaccine. The vaccine can be given up to age 26, and so even if someone did not receive it as an 11 or 12-year-old, they're able to receive the vaccine for several years afterwards. And so it's about education, and then it can be about cost. Not everyone has insurance that will cover this vaccine, and it can be expensive. So also thinking about ways that we can provide this vaccine to everyone in the community so that everyone, again, has an equal opportunity to have prevention for cervical cancer.
Yeah, so good to know that. I know you're trying to target kids before puberty in order to get their immune system best reacting to if they're ever exposed to this virus, but good to know that it's not too late. If you're now in your 20s, you can maybe ask your doctor about it if it's right for you. But I will also bring up that UTMB released some information this week, and they say that 2 shots might be equivalent to getting the 3 shots that that's currently recommended for this vaccine. So do you think that would encourage more people to get vaccinated if they then only had to go to a clinic twice instead of 3 times?
Hopefully. Also, so if you're less than 15, 15 years old, you only need 2 shots. After 15 years old, you do need the 3 technically, but we do have new research that might suggest that you only need 2. Certainly at this point, 1 is better than anything. We hope that someone would be able to complete the whole series for full prevention, but we're also still putting together all of the information and learning more every day as to what is absolutely necessary. But certainly 1 shot is better than nothing. So everyone should get vaccinated.
Dr. Zamorano, yesterday the White House had a panel on this because this is a really big deal. Cancer experts from all over the country were at the White House discussing this, and they were also brainstorming ways that they can make it easier for women. And one of the ideas is that they can get their preventative cancer screenings all in one visit. So they could get a mammogram and a pap smear all with just 1 visit to the doctor instead of having to come in multiple times. Yeah. So what do you think as a doctor and a provider, what do you think, is that even possible? Do you think that's a good idea?
I think it's a great idea. I think anything that we can do to minimize the strain on patients, no matter what their income status, it's time consuming and costly to visit a physician. And so anything we can do to roll all this in, I foresee some kind of logistical issues just because there are different providers who are doing pap smears versus who are doing mammograms versus also thinking about colonoscopies. It would kind of be a full day endeavor. A pap smear is a very quick procedure. It's a pelvic exam with a little brush that passes across the cervix. A mammogram is done radiographically. A colonoscopy is done by a GI doctor or some other specialist to look inside the colon. So all of these things, I agree, should be, hopefully they could be done all at once and you just have your like preventative health day. But right now the logistics of it seem a little bit complicated.
Well, I have faith that maybe we'll find a way to make
One-stop shop.
healthcare convenient one day. Thank you, Dr. Zamorano. It was a privilege to speak with you this morning.
A lot of good
You're so
information.
welcome.
Thank you so much.